Good day, everyone. This is Dr. Jamie, and I'm again with my friend and colleague Caroline Redmon, and we are going to talk to you about borderline personality disorder and the relationships they have with their loved ones. This is the fourth and the last video in our series, so let's get started. So if you're in a relationship with someone who has borderline personality disorder, you probably feel like you're at the mercy of their symptoms and that you're trapped. But you know what? You actually have more power than you think. So the question is, does your loved one have borderline personality disorder? If they do, you probably feel like you have to tiptoe around your loved one, watching every little thing you say or do for fear of setting them off. You often hide what you think or feel in order to avoid fights and hurt feelings.
And part of the reason that you feel like you have to tiptoe around is because people who struggle with borderline personality disorder are very emotional. They go from one extreme to another. They're either feeling really, really great and they're really loving it, or something can set them off. They get really upset and they get really, really offended. And sometimes they just will shut down, completely shut down.
Yeah.
And also on that, if the person that you love that has borderline, with them, there's no middle ground. Okay, what do I mean by that? Well, you're either all for them or you're all against them. If you are for them, they love you. They are willing to sit at your feet and hear whatever you have to say. But if you say something that they don't like or that they disagree with, whoa, then they get really, really upset and they're extremely offended. And I can imagine just sitting there thinking, oh my goodness, what happened just now? What's going on? I've
Yeah.
kind of lost it.
Yeah. Yeah, exactly. And it's like anything you say, anything you do will be twisted and used against you. And you feel like you just can't win. Their expectations are constantly changing. So you never know, exactly how you're supposed to keep the peace. Also, they basically will let you know that everything's always your fault. And so, you feel constantly criticized and blamed for things that don't even seem to make sense to you. And the person accuses you of doing and saying things that you never even did. You feel misunderstood whenever you try to explain or reassure your partner.
Absolutely. And there is a feeling of like, am I being manipulated? And I do have an example of that, may be helpful. Um, I know of a person who has a daughter who she's had a lot of trouble in her life. And as long as mom is taking care of her and supporting her, she, relationship is fine. But then if the daughter feels, for example, that mom's not being attentive or giving to her what she wants, the daughter will just fly into a rage. She'll get really upset or she'll threaten to do herself injury, which of course is a way of manipulating mom to get exactly what she wants to get.
Yeah.
And I can only imagine for someone in that position, it's like, I know I shouldn't be doing all this for her,
Mhm.
but I'm afraid she's going to do something drastic. So mom is sort of caught in a catch-22. And lots of times she'll just allow herself to be, manipulated because she's afraid. She doesn't know how to deal with the outrageous behavior.
Right, right. Exactly. That's a really good example. So yeah, there's no magic cure, you guys, but with the right treatment and support, many people with borderline personality disorder can, and believe it or not, they do get better. and their relationships can become more stable and rewarding. In fact, patients with the most support and stability at home tend to show improvement sooner than those with relationships that are more chaotic and insecure. So, on that note, what can you do? Well, the number one thing that you can do is to change your, like how you're reacting, manage your own reactions. That's how you can change a relationship. You obviously can't control your partner, but you can control yourself. So, this obviously can be really difficult because it's a natural human response to defend ourselves, right? But that's not going to work.
No, it never does work.
Yeah.
Did you want to say something else?
Oh, no, go ahead.
Okay. And a second thing that really, I can't underscore this enough, is having healthy boundaries.
Yeah.
And I think it kind of goes for both, because it is easy to be reactive and just say to your loved one, why can't you get it? Which is only going to fly them into a crazy more rage because they feel threatened, they're scared. But it's very important to set boundaries around their emotional reactions and helping them understand when you do make those boundaries, they're making the distinction between person and behavior.
Right.
Because they'll tend to take it personally, like I'm always in the wrong. I'm nothing but bad news.
Mhm.
But to help somebody when you're dealing with somebody, basically, I love you, but right now I don't love the behavior.
Yeah.
And to set the boundaries and say, when you are calm and even, I'm very willing to talk to you. I'm willing to work this out with you.
Yeah.
And also too, for parents or significant others or friends, whatever, it is very easy to take a borderline personality person's reaction personally.
Right.
Don't do it. It's hard, but it isn't really about you as the person.
Yeah.
It's really about their struggle.
Mhm.
And when those times happen, they get blind. They cannot see.
Exactly.
You cease to be who you are, and whoever and whatever is upsetting them is being projected on.
Right. Right. And so essentially they're emotionally desperate. Um, and they're whatever the other person's feeling is essentially being targeted onto you. And so with emotional targeting in an argumentative situation, it's a trauma response. It's that simple. Trauma response. There's no thought involved. It's just reactions, 0 to 100 in 0.03 seconds. So it really is not about you. Um,
Can I
so,
give an example of that when you're finished?
oh, absolutely, sure. Oh, go ahead.
Okay, years and years ago, I had a client who struggled with borderline personality disorder, and we were talking, and we were getting close to what the issue was that was bothering her. And then all of a sudden, there was this turnaround, and this person started yelling at me and screaming at me,
Yeah,
and something inside of me said, "Whoa, she doesn't see me.
yeah,
She's seeing her mother." And thank goodness I was able to recognize that and not take on her her troubles in that moment. So I just wanted to share that because I thought that was kind of an example of what we're talking about.
right. And that's the thing, sometimes, or usually, I think people don't really understand, uh, as you did, that this was about her mother. They don't understand that this is about something or someone else, because it's natural for us as humans to take it on, right? To internalize it. But you can't. You have to work really hard to stop doing that and remind yourself repeatedly, it's not about you. You've got to say, this is not about me. This is about something or someone else. This is not about me. That doesn't mean you're perfect, by the way, and that you're not the culprit in this argument. Don't want to make you think that. But, nevertheless, the emotional instability and the outbursts and stuff are going to just continue if you fight back, if you're defending yourself and taking what that person says personally. So you got to remember, what we said in a couple of our other videos is that borderlines are essentially trying to push you away most of the time because they are afraid of rejection and abandonment. So they figure that if they push you away, then they're at least in control of that. So, you need to remember that when they push you away, they're only trying to see if you're going to leave and confirm for themselves that they're not worthy and that everyone rejects them. So don't give them that satisfaction / not satisfaction, but assure them that you're not leaving, that you're still not going to be a punching bag, but that you're still going to be here, that, just be loving and patient to the best of your ability, although you might have to walk out of the room, but just remember, take that time if you need to and breathe. One of the other things is to be alert to manipulation. And I think, Caroline touched on that just a few minutes ago, when they're kind of becoming that victim, getting into that victim role. But, when something suddenly doesn't make sense to you in a situation, you're probably being manipulated. So, and again, remind yourself, it's not about you. Don't take it personally. The other person's just scared. They really are. They're scared, and they're trying to fulfill their emotional needs of power and control and safety and security and their need for love and acceptance. So, and this is when, like I said before, you'll experience that victim mentality from them. So,
And if you find yourself putting most of your energy into the relationship at the expense of your own emotional needs,
yeah.
this is sort of like getting sucked into a whirlwind.
Yes.
And to become aware of that, whoops, wait a minute, something might be coming up for me. And that's okay, because we're human. And the best thing to think about, if that's happening, get some therapy for yourself.
Yeah. Yep.
Work out with somebody, talk to somebody.
Right.
Another thing to do is create space. Okay, what do I mean by creating space? Creating space is learning how to breathe. There is something powerful in just deep breathing, 3 deep breaths, because that creates space between ourselves and whatever situation that we are confronting.
Mm-hmm.
Another thing is being very mindful. Okay, what do I mean by mindful? Being mindful. What is going on in my head and heart in this moment? Do I need to take a step back? Do I need to take 3 deep breaths? And
Good. Yeah. Good.
this helps to control our reactions, because it's very easy to be seduced into reaction.
Mm-hmm.
And then when somebody is borderline and they're struggling with reactions, and then when we struggle with reaction, whoa, it's like a dog or a cat fight.
Right.
No good comes of it. And so getting professional help is really important. And may I add, that doesn't mean getting medication. Medication is not the answer.
You mean you're talking about when when their partner who maybe has borderline, or their daughter or whoever their loved one is that has borderline, that they should get professional help? Yeah. Oh, okay.
Yeah. I should
It
have said
definitely
that.
does not mean medication. Yeah.
No, because medication only stabilizes for a short time, but it does not fix the problem.
Yeah. I mean, essentially it only works on, things like the depression or anxiety that comes with it, but it's not actually going to heal you from borderline personality disorder. So you have to put the work in. Yeah. Yeah. So, speaking of therapy, essentially, just letting you all know that when you're looking for a therapist for someone with borderline personality disorder, look for someone who specializes in trauma treatment and has experience specifically working with borderline personality disorder. And they usually cognitive behavioral therapy and definitely dialectical behavioral therapy. That doesn't mean they won't use other theories and adjunctive therapies and stuff, but those would be the two main ones. So if it's someone who knows, how to work with this disorder, they're probably going to be doing that, but definitely they have to be a trauma therapist as well. You have to have both things going on for this to really be successful. Unless you have a therapist who is just really down with getting in the mud with you, and learning. And it doesn't mean you can't find a good therapist as long as they're willing to do that work with you. So, yeah. Anything else that you can think of saying, Caroline, before we wrap it up?
I don't think so.
Okay. All right, good. Well, hopefully you guys, I hope this was beneficial to you. Um, we could actually talk about this all day. It's really difficult. I've found, and I would assume you feel the same way, Caroline, to kind of shrink this down into these 4 videos. Like we're trying not to go too long. There's so much out there about borderline personality disorder. There's so much we could talk about. So this has been really difficult in my mind. Like, what about you? Do you feel that way too?
I think it's a very complex issue.
Yeah.
It's not like 1 and 1 equals 2 because everybody's different.
Yeah.
But
And 1
generally
usually
speaking,
equals 13.
yeah, I guess it can. But I think basically the issue with many borderlines, again, like we've said earlier, is the feeling of abandonment.
Right. Yeah. Yeah. Yep. So, yeah, when they push you away, don't leave. And same for you therapists. If any of you therapists are out there listening, when they push you away, don't leave. They'll be back more than likely. All right. Well, I guess we better wrap this up before we do go way too long. I really hope that you guys benefited from this and that this was helpful. If you do need help with this, please reach out for help. Get some professional help. So thank you, Caroline, so much for doing this whole series with me for this month. I really appreciate your expertise and professionalism.
Thank you. It's been a pleasure. And I hope this does touch some people and help them to reach out for help.
Absolutely. I agree. All right. Well, everyone, I just hope that you have a wonderful day, and please don't forget to like and subscribe to our channel, and we will see you again, and we'll be talking about something pretty soon. So you all take care. Bye-bye.